Hello, good afternoon everybody. My name is Tamsin Rose and I'm the Senior Fellow for Health at Friends of Europe. Welcome to our event launch this afternoon, and I hope you've all had a chance to download our report, and let me show you what it looks like. We're very proud of the work that we've been doing with stakeholders over the last 6 months to explore how we can build a path to rare diseases in the European health data space. Now, of course, over the last 2 years, we've all had to learn how to operate in a very digital environment. And over the last few months, we've noticed this acceleration of the use of digital and telehealth tools in our health systems. But to the extent we don't understand yet, is this permanent? But we have seen where some of the gaps are, and we've seen the opportunities for change. What we wanted to do with this report was set out some key principles and recommendations going forward to ensure that when a European health data space is created, and that's the ambitious proposal that we're all working on at the moment, that it works for rare diseases. And I'm delighted that I have a couple of people who will kickstart our conversation this afternoon, but the format for the next hour and a half is interactive. And I'll be relying on you to provide your comments, your suggestions, and your input as well. And you can do that by putting a link in the chat or raising your virtual hand to let us know that you want to contribute. Because building a path for rare diseases in the European health data space requires co-creation, and everyone's input and expertise will be required to make this happen. So what I'm going to do is I'm going to take us through some of the elements in our report. Then I have a few discussants who will provide some input, and then we'll be having a debate with you. So let me just highlight how we got here and what it is we're saying in this report. And we started with 4 key principles. And you'll see that we'll be showing them, and they'll be turning behind me, the principles and the recommendations. And if you want to see them most effectively, you need to make sure that on your computer, you've got it as speaker view. And that way you will see the recommendations as they came forward. But let's start with our 4 principles, because of course the health data space is going to be very complex. It builds on 20 years of work at European level on e-health and interoperability, and getting the technical aspects to work together has not been easy, but a huge progress has been made. But we're now at the point of making political decisions about the extent to which we want to share our data, what's our governance framework, and how should it work? And we started our conversation by thinking, what would this mean for rare diseases? Now, of course, in the rare community, sharing data has been part of their DNA, because to achieve change, to get insight and knowledge for early diagnosis and even treatment, data from families and patients with rare diseases needs to be shared. It needs to come out of its silos in small research databases in university hospitals, and it needs to get to a bigger scale. So the logic for the European health data space working for the rare disease community is very clear. But understandably, our concern is that the needs of rare diseases might get lost in the bigger picture of getting the building blocks of the system to work together. So our focus has been, how do we make sure that the specific nature of rare data and its users can still be accommodated in the health data space? And our overall message here, and we've got this one strong thing, and if it's the one thing you remember from today, is that if the European health data space can work for the rare disease community, it will work for everyone. There'll be co-benefits for everyone. Because in the rare disease space, we're looking to identify and generate new knowledge and insight, make the data work multiple ways so we can find new expertise and new knowledge. And that then contributes to the broader amount of information that the health system has to use for non-communicable diseases and other areas. And let's again remind ourselves that, like you, I had the benefits of being vaccinated. The vaccines built on over a decade of research into RNA technology. And that came out of original research that was being developed for rare cancers. So we can see now the strong benefit between what might seem like a small niche piece of research on a rare disease, but could have huge benefits for the broader part of the health system. And that's what's at stake here. If we can build a health data space that works for rare, the benefits for everyone become clear. So let's have a quick look at our recommendations. We start with the first principle, and the principle should be that there needs to be federated access to harmonized rare disease data, and that this health data needs to be both interoperable and in a continuing over time, encompassing epidemiological, healthcare, research, quality of life, and treatment-related data. So it isn't just a disease database. And within that principle, we've got a couple of recommendations. And our first one is making sure that it's an interoperable and federated common access interface. So for the researcher, the patient, the clinician, they should be able to go to just one interface, and it should be easy for them to request information. So that we're talking about lowering the threshold for the people who need to use it. Particularly for rare diseases, that's absolutely key. And we have here specific actions that would make it better. Implementing the ICD-11 and the author codes to make sure at each country the data is entered in a similar harmonized way, which means it's easy to query. We also say the system, the process to access the data needs to be simplified so that you don't have to fill out 20 different forms on different ethical rules and fulfill 20 different sets of information in order to query databases that exist in 20 countries. You should be able to have a streamlined, fast access through the European health data space. Our second recommendation is saying that the rules should be common. They should be the same on accessing data. And right now, different countries have taken different approaches. In some countries, it matters what type of entity you are, whether you're a private company, whether you're a researcher, you have different rules to access. Other countries have said, well, actually, it's to do with the reason you want to access the data. If your reason is solid and scientific, you can have full access. So we just need to make sure that the rules are the same, common rules for access to data. And you do this through harmonizing your regulations around public and private access, promoting the FAIR data standards, that's findable, accessible, interoperable, and reusable, and integrating a very wide range of data, particularly for rare diseases where we're still building our knowledge and understanding. We need to have both quality of life and natural history data that's integrated into that. Our second principle, we should include the European reference networks and empower the users by building on the experience of rare diseases. Because, as we've said, data has been shared within the rare disease community for decades. It's the only way they've been able to make progress. So we should use that experience, understand where the problems have been and how to address them. And here we have some actions that would help us to deliver that. Enhance the existing rare disease sharing partnerships and to make sure that is integrated in the health data space. Explore the experiences of the rare disease community to see what worked and what didn't. What were the barriers and how could we remove them? We want to co-create with member states and all relevant stakeholders a proper comprehensive data strategy and an implementation plan so that the European Joint Programme on Rare Disease Partnerships can actually be delivered. And we also want to make sure that whatever governance mechanisms are created for the European health data space now can be future-proof to the extent it can be. We recognise that the business models of accessing and using data will evolve very quickly. The more data gets put into the health data space, the more it can be used, the more new options will come out. And we don't know yet what will be the way that value will be created from that. So the governance processes have to be allowed to be updated and have this flexibility to respond to that. Our third principle, we said that we need to extend and build the rare disease partnerships and leverage the existing initiatives such as the European reference networks, which for the last 5 years have been piloting this process so that the data and expertise should move rather than the patient. This is a real example of how European added value could make a difference to the lives of patients and the clinicians working with them. That the European reference networks for the first time created connections between different points of expertise so that the knowledge could flow. So let's use that experience. And here our recommendations are making sure that we can have a pipeline of data specialists. We're fully aware that in the very complex and full curricula for medical professions, often the part that deals with data, the part that deals with digital is very small. So we need to make sure that we are training enough people with data expertise to work within and build the European health data space. We also need to create new professions, new career pathways for things like a digital data manager or a data steward to accelerate the use and understanding of the way that data is collected and used for research. We have a recommendation making sure that there is increased data literacy, both for healthcare professionals, and I spoke about the fact that that's a very small part of a very busy medical curriculum, but also the wider public needs to understand more about how their data could be contributing to knowledge and could be used. And we have some specific actions around increasing the data skills training in medical schools, but also we need to empower rare disease patients themselves to make sure that they can make more informed decisions about their own health data and take a more participatory role and leadership role in how their data could be used and shared. Our fourth principle, develop digital skills for the rare disease community. And again, this is based very much on our experiences that were gained through the European reference networks, where there were different levels of expertise in using software. There was different capacities within universities and research areas. So we need to make sure that we are not just creating a database system and asking people to start using the author codes, but we actually also provide the training that allow them to do that. We feel that this will build a climate of trust by being transparent and showing the patient role in governance and making sure everyone's clear who will use the data, why it will be used, and for what purposes. We also want to promote the broader engagement of citizens. We believe that people will be much more comfortable about sharing their data and giving permission for this if they understand how it will be used, how it will benefit the broader community. And our final recommendation, which is now number 7, we want to demonstrate the experience of people living with a rare disease in sharing privacy-protected data to benefit diagnostics, research, and care. This is to show how individual patients and their families are able to make an enormous difference to the knowledge that we have out there and potential cures and treatments. And we use this experience to make the case for transparency for a broader patient community. And we'd like to be able to facilitate rare disease patients, their families, and patient organizations that represent them in the health data governance framework, so that it isn't just patient-centered, but there is a special place reserved and allocated for rare diseases because of the unique relationship to data. If the data is not shared for a rare disease patient, it means that they have very little chance of improved diagnostics, of better information about treatment, care, etc. So it's really key for this community of patients that their data is shared. So that gives you just the highlights of this report, and I strongly recommend that you download it, read it, and we are looking to create a community of policymakers and other champions who want to take this forward. So I'm going to be inviting you to please put in the chat if you've got a comment or feedback, but I will be taking a few key people who will give us some early messages before I open the conversation. And let me start now by bringing in Yann. Of course, rare disease communities, it should start always with the patients, their families, and their carers. And Yann, EURORDIS was our partner throughout this process. We had 3 different workshops, stakeholder conversations to get through this. And what we want to do is understand how this is working for the rare disease community. So my first question, as I've said, data has always been critical for the rare disease community. It's been a sine qua non for progress. How can the experience of the rare disease community in creating registries and in the databases feed into the European health data space?
Thank you, Tamsin, and good afternoon to everyone. You said it, in fact, we have an echo, Tamsin. Yeah. In fact, all the support provided by the European Commission through the DG Research programs and DG Health programs over the years on registries and databases for rare diseases has generated really a large experience from that community, an experience of collaboration first, but also in developing some standards. And what we've learned the hard way over the years is that the silo approach per disease or per country simply goes nowhere, take us nowhere. It's a deadlock. So only standardized approach, as you mentioned, with fair, interoperable data and a federated system is what can work for rare diseases. And we see European Health Data Space as that opportunity. It will enable to share data for primary use, for secondary use, for planning of health and social services, but also for research and generation of new knowledge. I'd like to insist on one thing, is that we sometimes, you know, that rare disease covers all the rare genetics, but also the rare cancers and other rare disease from poisoning or infections. And I'm often surprised to hear how much there is a focus on cancer, as if cancer was the only possible graal of the European Health Data Space. And I think I know the field of cancer pretty well too. And sure, it's more mature, but I'd like to see, when we're going to get into the thing really, what's the quality of the data and how much all of that is going to be interoperable between countries and between systems and etc. So I'm afraid that we have the illusion that it's much more mature and ready for the objective of European Health Data Space, but we may not be fully there. When for rare diseases, we're certainly less mature, no doubt. But on the other hand, that may turn into an advantage, is that there is much more flexibility and much more plasticity on how to shape the system. And we have the assets of the European funds networks. So I think we should not put all the eggs in the same basket of one disease area, but rather to prepare for several areas in order to make a strong proof of concept based on user case in order to build the success of European Health Data Space a few years from now.
Yann, and I note that Albert has put in the chat that, you know, what patients and their organizations, beside the theory, what they need is information that's accessible with one click on one site using plain language in as many native languages as possible. So I think he set out there for the patient expectation of the usability of the health data space. Yann, what impact do you hope that the European health data space could have for rare disease patients? Albert set out, you know, the hope of how easy to use it would be, but how do you see, you know, if we get this going, what could the impact on our knowledge and potential diagnostics and treatment outcomes could be?
Easy to use is essential to patients, organizations, but I would say for all stakeholders. You mentioned partnership before. Partnership in the private sector is not only industry, it's also the patients' organizations, the civil society, but also all the public sector, the people in charge of the planning of health and social services and the researchers. So we need that to be easy, really, for rare diseases and across Europe. The first impact we expect is obvious with rarity, is to address the issue of rarity. For us, data is knowledge. And knowledge is life. It's as simple as that. It's life in the sense that knowledge helps to gain years of life thanks to better care, because we're able to aggregate data from across Europe, but also across diseases or by therapeutic area in certain disease areas. So learning a bit from the side of the mainstream of one disease for other rarest diseases, but also the knowledge overall enable the development of new therapeutic options, of better diagnostic tools, and the better prevention of comorbidities. All that means life. And the second reason is that there is the high unmet needs. It's not only in terms of medicines. Data is extremely useful to build this knowledge base in the field of rare diseases. And we will learn, I'm sure, from big data, new elements also on the causality of some of these diseases, which would enable to develop better public health strategy in the future.
Thank you, Yann. Let me now bring in Anna Rath to give us some perspective, because obviously, you know, in Orphanet, you've been working for a number of years on this, and we've got in our recommendations the importance of using ICD-11 and the Orpha codes. To what extent can we build on the experience of the rare community to look at issues around data quality and quality control, because that's got to be key for the data to work. Everyone's got to be entering it correctly in the same way so that the data has validity when we look at it at the European scale.
Thank you, Tamsin, for that. From a researcher perspective, we can expect that what the European Health Data Space will bring is the huge opportunity to go and look at the bottom of the iceberg. We know that persons living with a rare disease are not all reaching the expertise networks that we have the chance to have in Europe, the European Health Reference Networks. And we know that we have this problem of diagnostic odyssey, where we have the problem of burden of rare diseases that is completely hidden and out of the radar of policy managers, of decision makers and hospital managers and the community as large. So in the European Health Data Space, we hope that we could have this evidence that will allow to make informed decisions that can, I am a strong believer on that, dramatically the lives of persons living with a rare disease. But for that, we need to access data. As you said, the data should be of a certain quality in order to be exploitable. And for that, we need, in general, and in rare diseases in particular, a common data models, a common set of standards that the data sources should adopt when it comes to export their data or to expose their data. We won't change the way the data are collected or standards that are used in different settings in different countries. That is an ideal world, and that won't happen. What should happen is to have a common set of standards that are interoperable with what is happening in the real life in data sources. And for that, we need to have strong data models, strong data standards, and when it comes to rare diseases, to have ORFA codes, other rare disease specific standards, and mapping systems that allows for researchers to evaluate how accurate are the data in order to capture all the rare disease data that is not visible today. So for that, we really need to have a strong quality assurance system at the European Health Data Space that is kind of imposed to the nodes of this data space. As much as this to be European Health Data Space compliant, the nodes should have certain requisites, and that will improve with the time going, the quality of data that researchers will handle. And in the meantime, we will need to have mapping systems and other artifacts that will mitigate the lack of quality that we know exists for rare diseases in all the data sources.
Excellent. Thank you very much, Anna. And if I can see again, we've had another comment from Albert, who's from the Huntington League, and he's saying that he can share experience of the way that the Huntington community is working in a coordinated way across Europe and even across the world. Albert, that's really interesting because we've just heard from Anna that we need to have mechanisms, and she talked about mapping systems to mitigate the lack of quality and consistency. Please feel free to share in the chat, what you can see about how you get around this challenge, because you work, as you say, across Europe and globally. How have you dealt with this issue that you've got different inputs? Albert, if you want to unmute yourself.
You asked me to comment.
Yeah.
It could be long if we are speaking about Huntington organization, but it's working worldwide with one single coordinated organization. It started long ago, 50 years, 60 years ago in the United States, but let's take only in Europe. You have EHDN, the first on that I have put in the discussion, is the coordination between patients and the science, based in the University of Ulm in Germany. That's one point. The second point is EHA, is the coordination of the patient's organization. The third one is HDYO, is Huntington for the young people, because Huntington is a very special disease, a neurodegenerative disease. And HDYO, sorry, it's just for young people, through young people, talking to young people in a young people language, always with supervision of experts, etc. Because it's not a chat, it's not Facebook, it's just scientific language for young people. The fourth one is HD Buzz, is a let's say a newspaper, a newsletter, just in plain language to give scientific information accessible for I would say normal persons, lay persons. And the last one, I have not put it, or maybe well, in the chat box, because it's Enroll HD. Enroll HD is a long-going survey all over the world, gathering data from 25,000 people just in one single available database or biobank, you call it, just available for researchers making specific research in Huntington. With that sort of coordination, you can make progress and not working, as Yann said a little before, not working in silos. You have to work more globally for rare diseases, because working in silo, you know, Huntington is 1,000 people in Belgium. How will you make something consistent for 1,000 people in one country? So you need to work more coordinated for rare disease. It's absolute necessity.
Thank you, Albert. And I think it was you gave us a really good overview of just how proactive the rare disease community is in terms of bringing the patients together in their national context, at European or global context, and setting up a number of different mechanisms, whether it's a research database that allows researchers to access it and to further knowledge, providing plain language information for patients so they can play a greater role and understand more about what's happening in research. So this is exactly what we were talking about when we said that the European health data space should build on the experiences and the successes of the rare disease community, because all of these are key elements in the health data space. Let me now bring in Andrzej Rees from the European Commission, the director there. I'd like to just give you a sense of how the Commission's plans for the European health data space correlate to some of the things that you've seen in our report, where we set out the principles and the recommendations that we'd like to see in the European health data space.
Thank you, Tamsin. Good afternoon, everybody. I think it's the number of those recommendations are very much, on our radar, and of course they will also support, number of ideas we like to bring. Just maybe say a few words. We start from the year ends, because this is very variable, development in the European Union. And as you rightly said in the introduction, it's difficult to imagine this experience, and investment we made together will not pay back in this European health data space exercise and the future system. So we try to learn, and we of course doing this together with the all, as we call them, communities of ERNs, with clinicians, with patients, with also hospital managers, but also with member states representation. So I think it's important really to harvest from this exercise. The second, I think it's also what you show that how important it is also to kind of build on successful stories and incorporate this in the future, including also the right skills, because the skills and the kind of digital skills agenda is very important one, and we hope that during next years we'll be able to invest more in this field. We are building up the number of coalitions networks around this. Just mentioned the networks of the deans of medical schools when they are discussing how to rethink the whole curricula in medical schools, but also questions about the future professions. As you rightly said, what kind of people we need to kind of analyze data and also what Anne said, help with this informed decision process. We also need to have kind of brain power, not just computer power to do this. The next area, which I think is also important, this is the kind of European trust agenda. And I think one of those important framework is GDPR. And we are learning, also during the work of EURORDIS, the way we also are building up, for example, the consent form, registries, access, all these debates are going on. And I think it's also showing, that it's possible, and we build also this into the future legislation. And very last point, it's about recommendations of promoting access to data. And of course, this question of access is not just for researchers or industry, but of course also to the public body, as was said, I think Yann gave example, how to plan the future facilities, future investment in this field, or how to do, for example, health technology assessment. And maybe very, very last point, if you allow me, you also call for this kind of partnership approach. We really believe this is right thing. EURORDIS by nature, they are kind of partnership, more kind of public partnerships, but we really see there's a lot of opportunity coming through the future partnerships for rare diseases, but also for a new version of IMI, which we call the Innovative Health Initiative. So we are, I think, in this moment of setting up the future framework, which is one of your recommendations as well, but at the same time, we have to continue build on the experience and progress on the investment we have done.
Thank you, Andrzej. Let me ask you a second question, because I think this has been key in our report. The message that we picked up in our conversations with stakeholders is there's often a gap between what's decided at European level and the reality of implementation at member state level. And we talked in our conversations about the importance of making sure there's support for member states, whether it's resources, financial resources, or it's support for infrastructure or for training. So from your perspective at EU level, when we're thinking about a user-friendly governance and an accessible mechanism, how can you support member states to develop the health data space and make it workable?
Again, using experience we have from rare diseases field, which is also your approach in the report is first we need to understand the needs of individual member states. The developments are going at different speed. We have member states already are setting up kind of if I put in brackets, the future elements of the European health data space, and we would like them to kind of pilot and see how they can, for example, exchange between themselves data. So this is example. So those champions, and they can already start to move a bit to the next level. But at the same time, we are continuing investment in the setting up, for example, the helping with national systems, with national contact points, which are quite complex organization, helping with the interaction between European system, national system. Even today, as we speak, we have the meeting of eHealth Network when we are discussing the next wave of investment for those countries. They are still in kind of developing phase, but simultaneously, they already are countries. They are already sharing the experience, as today, for example, Czech Republic or Luxembourg show their kind of lessons learned, and difficulties they face, and how they learn a lot, from sharing knowledge and experience with other member states. So the sharing experience is the next important element. And the last important element, of course, is investing in infrastructure. This is something which, in one hand, that we see that in not just in European EU for Health program, which is one area of investment, or Digital Europe, but also international program. When you go to the Rath, which is the important, investment from European and to the national systems, you see the number of countries decided to invest relatively heavily to the health digital infrastructure. So all these things putting together, legal framework, learning from each other, giving kind of additional resources to the targeted area like digital health, and finally, pulling expertise together, it should work.
Excellent, thank you, Andrzej. Let me now bring in Maurizio Scarpa from the MetabERN network. Maurizio, you've been involved, obviously, for the last 5 years, leading one of the European reference networks, and you were also coordinating the 24 different ones for a period of time. In our report, we call for the importance of learning from the experience of EURORDIS, for better and for worse, to understand where the challenges are on both collecting the data and creating the trust between institutions so the data flows. What are your hopes that the new health data space would deliver?
Well, thank you very much, Tamsin, for the invitation. First of all, the ERN, in my opinion, is an incredible tool that we have to really pilot studies and projects about this. The European data space is the future for management of data coming from hospital for the service of the patient, of course. The expectation from the ERNs actually, or what we can learn from the ERNs, is two things. The first one is that the ERNs are made of hospitals. And so one thing that we need to learn in the future is that every hospital is by itself a silos. And indeed, we are generating, right now we are speaking, billions of data in the hospital that are really a treasure. But unfortunately, they are all unstructured. They are all, in a way, not of enough quality to be reused. They are not for sure interoperable. So this is something which is representing a very big limit for the activity of sharing of data. So what we are expecting a clinician and the ERN is actually to develop projects and to develop programs that are actually changing the mentality of generating data in our hospital, and are making the data really under a governance of the data quality, and especially to create infrastructure for collecting data, because I am not aware of in Europe European hospitals that have an infrastructure that can be used throughout Europe. Of course, the ERNs are a good structure to work on this, because we are all very much connected. And you remember that I was the first coordinators, and from that moment, it was 5 years ago, we promised and we work all together to indeed step forward interoperability. And we are participating to different programs like the EGP, the C4C, the ERICA project, to create a pathway for interoperability, for changing the data quality, and to really work all together for this goal. We have even set very recently a European program regarding the automatic feeding of registries, rather than creating interoperability platform and artificial intelligence tools to interrogate clinical data. We are, of course, led by our motto, which is, share, care, and cure. Because share is one motto of the ERN. So we need to share experiences, we need to share data, we need to share a patient in order really to promote and to progress in rare diseases. About care, we have indeed, since the beginning, a very powerful platform, which is a clinical patient management system, which we hope it will become the first platform to share the data for a better care. But we are also very aimed to the cure of the patient, and sharing data is extremely important to launch new clinical trials, natural histories, rather than better registry, interoperable registries in order to, as you said, harmonize the data collection to promote, you know, the referability of the data, so the findability, accessibility, and whatever. So I think that at the end, the ERN should be really the matching point, the bottleneck of all this activity. And what we are very keen is to collaborate with any other stakeholder to really help in themselves and ourselves for a better generation of data. The GDPR is extremely important. This probably is a little bit a limit sometime in our work, because I mean, it is extremely protective, the privacy, whatever. Sometimes it is also in a way a limit to the activity that we can do. So we need also to learn how to manage the GDPR, how to apply and how to comply in a very good way in order that really the data can be accessible and usable and reusable for our goals, which is to treat better the patient, to find patients even at risk, and to treat the patient better because we know how the patient is behaving with our treatment. At the end, what we are looking for is really digitalization and future for that.
Thank you. Let me bring in now Tapani Piha from FIPRA, which is in Finland, and on behalf of the Finnish government is leading a joint action on behalf of member states to help develop the European health data space. Tapani, we've heard about some of the challenges, and nobody underestimates how hard it's going to be, that a lot of the data sits in hospitals, and hospitals are their own silos, and these billions of new data points being created every day. But our question here is, you know, how far are you progressing in TEDAS, and, you know, some of the principles and recommendations that we have put forward, and Situ was part of the group of stakeholders who helped us come up with this. How do you see the new health data space? I mean, are the member states ready? Do we have the infrastructure in place to make it happen?
Thank you, Tamsin, and hello to everybody. This rare diseases network ERNs, they are very close to my heart because I worked with you many years, and I'm happy that now I can a little bit push this on another side. The TEDAS joint action is a project which is working with the member states and the Commission to develop some concepts of the European health data space. So, of course, the Commission will come up with their proposal using its rights of initiative, but we are trying to support the Commission by developing those ideas and also creating among member states the approach to this European health data space. One thing which I think that it's important is that we have been discussing in the European in TEDAS is that it's clear that we will need to build the European health data space on the elements we have at hand. And when we have been going through the infrastructures which do exist already in Europe and which are in operation, ERNs is one of those prominent ones. We have others also, like My Health at EU, which have been creating things. The European reference networks have a particular interest for TEDAS project because TEDAS project is focusing on the secondary use of data. And of course, in the European reference networks, we are also looking at the primary use of data, but we will also be looking at the secondary use of data in the rare diseases. So what we hope is that by building these concepts and by building the European health data space, we create some kind of umbrella which brings together different initiatives and provides them support in expanding this cross-border exchange of data. I heard many of you saying that we need to have smoother access across borders, and that's exactly where the European health data space can bring added value. It is likely that we continue having different infrastructures for sharing data, because you cannot share the rare disease data with the same infrastructure as you are sharing genomic data. So I think that the European reference networks can expect from the from TEHDAS project support in its endeavors. And indeed, we are happy that you have been helping us also by consulting us and attending our advisory boards.
Let me now turn to the European Parliament, who's obviously got a key role in both helping to set the vision for the European health data space and looking at its implementation over time. And I'm delighted to introduce MEP Stelios Kympouropoulos, who's a member of the European Parliament and also a rare disease patient himself. Let me ask you, what do you see as the role of the European Parliament to make sure that the European health data space is both implemented and can fulfill its potential for better health outcomes for rare diseases?
First of all, Tamsin, I would like to thank you for organizing this timely event, for publishing your very important file about the issue that we are discussing. And I'm very glad that I'm among the distinguished guests to discuss this very important issue. From my point of view, I think that data-fueled technology have a great potential in the area of healthcare. They can facilitate better distribution, personalized medicines, and faster, more accurate diagnosis and efficient therapy. Particularly, patient registries and database could encourage the development of clinical research in the field of rare diseases, as well as improve patient care and healthcare planning. So far as there is no uniform governance on the collection, organization, or availability of this data, and more than one registry often exists for the same rare disease. However, at the same time, existing registries account for approximately only 20% of all rare diseases. The European Parliament can work towards creating a common governance to collect as much data as possible, to facilitate and promote the transfer of knowledge, experiences, and best practices with the ultimate objective of creating a global community of knowledge, as other speakers said. This will enable better measurement of outcomes, empowering patients, and create new ways of communication between healthcare professionals and patients. To do so, the European Parliament should ensure the relevant EU legislation enables individuals' ability to exercise their data portability rights. Citizen patients should be transformed from data subjects to key agents and agents in the health data area. But to make this happen, we need to do investments in education, in digital literacy, building public understanding of and trust in how health data is used for the benefit of the European community. Patients must feel that their data is secure, and this is not has to be done only with GDPR, and being treated in compliance with applicable data protection framework. And that also requires a comprehensive set of additional guidelines and measures to ensure the transparency and accountability for the processing and sharing of data. Furthermore, we should develop a common code of conduct for health data used for scientific research to secure uniformity across the EU member states. Also, the European Parliament should promote the uniform application of the European electronic health record. The digital capabilities of health systems should be radically upgraded, including cloud technology, as a secure and economic infrastructure for driving digital transformation. The collected data should be compared based on an interoperability framework. And most of the member states should be equipped for cross-border patient data sharing by 2023. It's beneficial for everyone, the healthcare professionals, but primarily for the primary recipient of the healthcare services, the patients. But above all, we need a concrete proposal by the Commission as soon as possible. Once it's out, we, as co-legislators, we make sure through our amendments that the interests of patients with rare diseases and not only are a priority and reflected in the setup of the European health data space. As a parliamentarian, I'm here and other colleagues to listen whatever it is said and to implement in our future legislation.
Thank you, Stelios, for setting out again a vision, a strong vision where the European Parliament can set its expectations about what the European health data space should and could deliver for rare disease patients in Europe. Let me bring in somebody else from the European Parliament, one of your colleagues who'd like to share some input, and that's Mr. Juozas Olekas, MEP. What would you like to share with us about how the European health data space could deliver for rare disease patients?
Thank you very much. Unfortunately, I am from public space. I need to wear my mask, but maybe you hear me.
Yes, we can.
Yeah, I fully agree with my colleague what was said and previous prelegents what they said about the needs to have the common data space for European, particularly rare disease, because they are from the member state. But if we have the general view on European level, we have quite enough information about these diseases, and we should exchange and should use it. And have one place where we have collect all of them and to use for our medical and research needs. But keeping in mind that need to have the more stronger union, I propose or suggest for you to have maybe more stronger European health union. And we discussed here in the Parliament, we created a group for stronger health Europe. I think we need to discuss this in the European conference on the future of Europe, and promote our ideas and try to build new facilities for European Union, for the Commission. From my point of view, I think we need to discuss about the need to strengthening European Union influence in the healthcare, not only on the prevention, but also on the healthcare. And from my point of view, we need to discuss about the needs to change the treaties and to implement more responsibility for European Union, particularly in the rare diseases, because we have a lot of influence on trade, on free movement, but the COVID crisis shows that we need to have more influence on the treatment of rare diseases, I think, in particular. And this is my point of view, that we need to maybe strongly unite our efforts from patients and organization, from the scientific part of our society, of universities, healthcare workers, and for that we need to have stronger, and only when we will be more united we can found the way how we can solve this problem with rare disease. Thank you very much.
Thank you very much. And again, making the link to how important the issue of health is in a COVID perspective to European citizens, how much it's gone up their agenda, what they want to do. We've just got a few minutes left, and I'm going to invite, just for a very short 1-minute intervention, Xavier Kurz from the European Medicines Agency, because of course data is absolutely key to our understanding of the therapeutic use of medicines. We're also starting to look at real-world evidence and how we understand data in a regulatory perspective. And a lot of that's very key for rare diseases where we get off-label use or we need secondary use of existing treatments. Xavier, what comments can you add for us?
Yeah, okay, very shortly then. As you know, several years ago, EMA started the patient registry initiative, and with a number of activities, and which one of them was the publication last week of the guideline on registry-based studies. But I would like just to express 3 lessons learned. The first one is to state how useful are the data on rare diseases for the regulatory activities, and this may link not only to regulatory procedures on specific medicinal product and on advanced therapy, innovative therapies, but also outside procedures. For example, it's extremely useful for us to know what is the natural course of rare diseases. Also, what are the standards of care? What are the characteristics of the population and of the patients who are included, so that we can contextualize and support the clinical trials and support the drug development. So this is really, I would like to emphasize this, how useful it is and how useful it is that we have access to this data. The second aspect is the need for transparency and sharing of information on the data sources on a rare disease, and these include data elements, data quality management, but also the governance structure and what is the capacity to provide, to share data and to analyze the data, and all the operational aspect for participation in research activities. This is not for all to all data source on rare disease that it is possible. So this is very important to stress these factors. Third lessons I would like to convey is that there is a very large heterogeneity between the data sources on rare disease. Many differences in terms of governance principles, which may be influenced by different factors like funding sources and also the legal environment and operating procedures. And these differences are perhaps not possible to cancel and to deal with, but it is then therefore important that when we want to make secondary use of these data, that it is possible to have standardized set of data that could be used for studies and for research, and this may require that possibly additional data collection is made, or mapping of some of the data into common data models are performed. So these are, you asked me to do it quickly, so this is a quick update of quick information on lessons learned from our activities.
Thank you, Xavier. That's extremely helpful for you to have shared the experience from a regulatory perspective, because of course this is an area that's of key importance as we're in the process of updating and reviewing the Orphanet Medicines Products Directive. So understanding your experience is extremely helpful. A warm thank you to everyone who's been putting additional information in the chat. We've been looking at, thank you to Diane Whitehouse for sharing ideas and questions, and to Bert Verdonk, you were part of our different stakeholder conversations and helped contribute to our report. I see that we have Peggy Maguire from the European Institute of Women's Health, and I know that she's been working for a long period and making sure that the data we collect is gender disaggregated, so we start to see where the gaps are in our activities. Thank you to various patient organisations who've also been adding in their elements. We've come to the end of our time together. We had 1 hour to launch this report, and I really recommend that you download this and look at it. There was a lot of work that was done. Very generously, stakeholders shared their time and their expertise with us. We see this as our contribution to a conversation to take this idea forward, because at Friends of Europe, we see health as being critical to citizens. Over the last 2 years, the ability of the EU to demonstrate its value to citizens has become very clear as Team Europe has delivered its targets on vaccination and other areas. We see the European health data space as being the next area of high performance and high delivery for citizens. If we can make this work, and I'm not underestimating the technical complexity and the challenges of linking public, private, clinical and research environments, but if we can get the European health data space to work properly and effectively, making it easy for researchers from wherever they are to access the information and generate new insights, then this will have a huge impact for citizens. And they will really see a Europe that works for them. It will also make it very clear why a European Union is a European health union. And thank you for the people who highlighted the links to the Convention on the Future of Europe and exploring the additional mandate or role that Europe could have in health. In our recommendations, we called for greater trust to be built, transparency in a governance structure that allows patients to be both empowered and at the front of the conversation. We talked about investments needed in the capacity of our healthcare workers and our policymakers to understand the data and how it can be used, to talk about the legal frameworks and the implications. And thank you to colleagues from TEDAS putting links to the report where you've looked at the learnings of how Europe currently is very fragmented in the way it approaches access to data. Our recommendations call for a common approach because that's how we make it easy, whether you're in Porto or in Helsinki, to be able to access the data and generate this new insight. We also recognize that new knowledge won't just come from health data itself. That needs to be linked to demographic data, to epidemiological data, to geographic data, to weather and environment data. All of these things will help to build a knowledge center that allows new breakthrough for disease. And I think the last 2 years have shown us that we don't know yet what our health threats will be for the future, except we know there will be more and more unexpected things about which we have to research and learn. We need to collaborate and make the power of data work for its citizens. And we sincerely hope at Friends of Europe that the European health data space provides that opportunity, that its potential can be met. That will require work at European, national and local level. And we will be tracking the recommendations of our report to see the extent to which it can deliver on its promise. Thank you to our partners who accompanied us on this journey and helped make it possible. The participants in our 3 working groups so far who, as I said, generously shared their insight and their time. Thank you for being part of this working group. Please download the report. Share it without moderation to as many people as you think you can find who would use this and can apply it. And see you again at our next event for Friends of Europe. Thank you and goodbye from Brussels.